very much. I'd like to thank the Fourth International Conference on Tissue Science and Regenerative Medicine for inviting me to speak today, and for everyone who's attending. So today I'm going to tell about our research that we're doing using stem cells obtained from human cord blood for the symptoms related to chronic inflammation and aging. I'm also going to tell a little bit about some of the interesting patients that we've treated and a little bit about some of the other findings that we have. So as we've seen from a lot of our presenters today, the uses of stem cells are almost endless. They can be used in many different areas of the body. This study is looking at the treatment of inflammatory diseases. Of course, aging is a progressive degenerative process tightly integrated with inflammation. Chronic inflammation is associated with a broad spectrum of neurodegenerative diseases and aging. And mesenchymal stem cells represent a valuable tool for the therapy of symptoms related to aging and chronic inflammatory diseases. Our company's name is Blue Horizon, and we foresee a future with stem cells become the preferred substitute for many surgical, pharmacological, and rehabilitative medical services. As a lot of our other presenters have demonstrated today. So how do stem cells work? They seem to help regenerate injured tissue. It seems that they migrate to the area of the injured tissue and regenerate to make it healthy and help to grow new healthy tissue. At Blue Horizon, we use non-embryonic, non-fetal stem cells. We basically use stem cells that are either harvested from the patient and then expanded in the laboratory, or we use stem cells harvested from the cord blood of a healthy baby, harvested at C-section. There's no injury to the baby or the mother. Or we use stem cells that are cultured from the Wharton's jelly of the same placental tissue. We typically administer them either IV, or if the patient has central nervous system pathology, then we also administer a dose intrathecally. We started in 2010 and currently have facilities in New Jersey, Wuhan, China, Slovakia, and hope to be opening in Berlin soon. We have autologous and cord blood stem cell transplant therapies for many conditions, including spinal cord injury, traumatic brain injury, Alzheimer's, diabetes, myocardial infarction, osteoarthritis, post-traumatic arthritis, Wilson's disease, and many other conditions. So we have a foundation as well, so a lot of our patients are treated on a charitable basis. So we're trying to combine a treatment with scientific research, and then charitable care and health improvement. In this protocol, the stem cells were collected from the umbilical cord blood at C-section. The stem cells were then isolated from the umbilical cord blood with several washing steps. They were counted and then resuspended in a cryopreservation solution. It's all done in our GMP laboratory in Wuhan, China. They're checked for diseases before going, into the freezer. They're then transported to, in this case, our facility in New Jersey. They're thawed on the day of treatment. They're checked for viability, and then they're suspended in some saline and then infused IV. So these are some of our results from China with our stem cell treatments for spinal cord injury, which basically consists of an IV infusion and an intrathecal infusion. The dose split about 50% each, and we use the entire yield of one placenta cord blood yield on one placenta for one dose, and with 3 injections generally spaced out about a week apart. We had 90% improvement with 89 spinal cord injury patients and 94% improvement with 97 stroke patients. So this is one of our Chinese patients. He's a 21-year-old man that had a traumatic brain injury, vertebral fracture with spinal cord injury. He didn't have any lower extremity muscle strength. He had sensory loss and urinary incontinence. And then after the course of 3 injections, his muscle strength improved, his sensation was restored, his incontinence partially improved, and he was walking with crutches. And then, actually back to this patient, I'm missing a slide, but a year later, he was basically almost fully recovered. So that was good. This is another patient. She was in a coma. She had bilateral thalamic hemorrhages, and she was basically just in a vegetative state. Then she had the same treatment, and after the treatment, she was able to stand with assistance. Her language function improved, and she had partial motor function improve. So that was amazing. Another young man had a pulmonary embolism, and he basically had a hypoxic ischemic encephalopathy. He had high muscle tension, movement disorders, resting tremor, irritability, and he was aphasic. And then he had the same basically protocol, 3 injections split between IV and intrathecally. After 3 weeks, he was able to walk 200 meters, his tremor improved, and he was able to pronounce simple words with partial recovery of emotional expression. And then after 12 months, he had nearly a full recovery. This is one of our diabetic patients. She had a foot ulcer, and her diabetes was poorly controlled for 8 years. And after, this would just be IV, 3 IV treatments that she had, probably about a week apart. Her sugar control improved significantly, and her heel ulcer went on to heal. We've had a number of patients with Wilson's disease. These are 2 of them, 2 brothers. Before the treatment, they had hand tremor, ataxia, dystonia, migraines. One of the brothers wasn't speaking, depression, anxiety, and then after the treatment, they pretty much returned to normal, went back to work. The one went back to school, so that was amazing. The cost is relatively low. It's $10,000 per injection, so that would be $30,000 for 3 injections. But we have a lot of patients treated through our foundation on a charitable basis. We haven't had any reported complications in either our Chinese or U.S. patients. We've treated over 800 patients in China and now about 50 patients in the United States. Our U.S. studies are IRB approved. This is our IRB approval certificate. And we published our first study earlier this year in a U.S. journal, Cell R4. And so this is basically our pre-FDA pilot safety study that we did. So in this study, we were looking at blood tests before and after the stem cell treatment, and essentially we didn't have any negative results with the blood tests. Some of the patients improved. We had 10 patients that had a significant improvement in their blood work markers. So this is just a slide. I won't go through it because we're running so late, but basically no one had a negative impact on their blood work from the stem cell treatment, and about 10 patients had an improvement in their profile. This is just a little graph of that, the lipid panel, liver enzymes, metabolic panel, and the blood panel. Here's some of the things that patients noted: improved skin, accelerated hair and nail growth, increased energy level, improved sleep. One of the side effects we seem to notice a lot is patients need to take a sleeping pill like Ambien or something like that for a week or 2 after the treatment because of the increased energy they experience. And a lot of patients experience pain relief if they have some type of arthritic pain. Here's another graph of some of that data. And those are our citations. So thank you very much. I really appreciate everyone's attention. I know we're running very late, so